Every decade of life has its rewards and doctor visits. Dr. Jen Landa is here to explain what tests are necessary. Good morning.
Good morning, Rachel.
So what tests, are these tests that doctors are prescribing and asking for, or do we need to specifically ask for them?
You know what, Rachel, that's a great question. Preventive medicine is really the cutting edge. That's really where we need to be, but that's not where most doctor visits wind up, because we have 6 to 7 minutes on average for the average doctor visit. So we really have to walk in with an agenda. We have to be prepared and know what tests to ask for in case our doctors aren't doing the preventive tests.
Okay, so help prepare us. If
Okay.
you're in your 20s to 30s, what should I be asking?
So in your 20s to 30s, there's a bunch of things that are on the screen, but some of the things that I want to highlight are hemoglobin A1C. The
Okay, what's that?
hemoglobin A1C is a test that looks at your average blood sugar over the course of 3 months. And that tells us what your risk for diabetes looks like. It can diagnose pre-diabetes, so before you even get diabetes, and I help patients every day reverse their risk of diabetes and get out of diabetes into a normal blood sugar.
Especially since diabetes is on the rise right now.
Absolutely.
And then, okay, take us to our 40s. There's a lot of hormones changes are happening.
Absolutely. A lot of us notice hormone changes start to happen in the 40s, especially because we have such climbing stress levels nowadays. So we make cortisol hormone, and then we don't have enough hormone precursors left over to make estrogen, progesterone, testosterone for both men and women. So we need to look at those hormone levels and balance them and replace them.
And there's tests for that.
Absolutely.
Can
There are
check that out.
tests where we can look at that.
That's good. And then 50s, 60s.
The 50s and 60s, we want to look at some new things. Bone density, especially for women. We want to make sure that our bones are strong, because otherwise we're going to have hip fractures when we get older, which can be lethal. No, absolutely. And for men, we want to make sure they're getting their digital rectal exam, which I call the finger exam.
Oh.
Well, nobody wants to talk about it, but
you
it's
have to
important
do
to
it.
check their prostate and make sure the prostate is normal to look at risk of prostate cancer.
And that's really important.
It is.
Thank you so much, Dr. Jen.
Thanks for
For more on all these tests and which ones you should request, just go to bodychecklist.com.